Hi, I'm Katie Farrell. I'm an assistant clinical professor and track director for the Quality Safety Risk Management program. I've been at Drexel full time since 2019, so coming on 5 years. I'm a nurse by background, so I have a BSN from Georgetown University, my MSN from the University of Pennsylvania, and most recently my EdD from Drexel University. So an alumni and also faculty member. I live in the suburbs of Philadelphia with my husband and two daughters. Growing up in Philadelphia, I always knew the reputation of Drexel University. I was working in hospitals in Philadelphia in quality and safety. And in 2014, I was approached for an opportunity to teach adjunct, teaching some quality and safety courses in the College of Nursing and Health Professions. So I taught adjunct for 5 years and really loved the opportunity to interact with students, to teach them about quality and safety. So when the track director role opened up in 2019, it kind of felt like a no-brainer to apply for it. It really felt like a great next step for my career, so that I could further expand my teaching knowledge and expertise. So I teach mostly in the MSN program, in the Quality Safety Risk Management program. So teaching the students who are pursuing an MS or MSN in Quality Safety Risk Management. I also teach in some of the core courses, so courses that all students are taking. And then recently I've started teaching in the DMP program. So our Doctoral of Nursing Practice students, teaching them quality and safety courses. I have published on patient safety, as you can imagine, looking at ways to improve patient safety and also ways to support our students in understanding patient safety. For my kind of passion for research, it's really been on implicit bias in nurses. When I think about quality and safety, I always think about making sure that the patients are really at the forefront of everything, partners in their care. And what I found is that implicit bias, which is something that we all have, can really have a negative impact on patient safety, patient outcomes, and the patient experience. So I actually did my doctoral research on implicit bias in nurses, looking at really ways to support nurses in understanding their biases that they have, and also strategies that we can incorporate into nursing education to reduce biases when they do occur. When I was pursuing my master's, there wasn't a lot of focus on quality, safety, and risk management. So I started working as a nurse educator, which was fantastic. But what I found was I was really into that systems thinking approach and looking at ways to make improvement, like I said, to different structures and processes to have better outcomes. So with that, when I realized that I was really passionate about that, I started to look for opportunities working in quality and safety in hospitals. Um, Landed a role that was really, a great role for me, that I was exposed to so many different initiatives. Like I said, looking at the patient experience, looking at patient safety, looking at nurse satisfaction, the work environment. And really, I was not, I was not caring for patients directly, but I felt like everything you do in quality and safety is impacting the patient and your staff. I also, as I said, had a master's in education. So I really enjoyed teaching. And when that adjunct position became available, and then later the full-time position, it was really the perfect fit for me to have that passion for quality and safety that I have, in addition to the desire to educate our future leaders. Really, my favorite part is, as kind of cheesy as it sounds, when the students get it. A lot of them come in and they're like, I don't really know if this applies to me. But really kind of shifting their mindset to understand quality and safety and really be excited about it makes me excited. I love working with students. I think we are so lucky that at Drexel we have some of the best students. I might be biased, as I said, I did my research on implicit bias, but I think that we have some of the best students. And they come to Drexel because they're so eager to learn. And we're coming up on graduation, and when they graduate, sometimes you feel like a proud parent because you met them when they were just starting, and you've just seen them grow, and seen them learn so much and become, so much stronger in their field, in communication, in their, knowledge and expertise. So it's really the opportunity to work with students. Obviously, I teach in an online program, but I really feel still so connected to the students because of the way the Drexel program is. So the most helpful advice that I've received, I think, is really uh, to not be afraid and be curious. It's very easy to go into a new role, and just kind of sit back and kind of stand on the balcony and watch the stage happening. It's really important to not be afraid and to get on that stage. And you might be taking some risks, and they're not real risks. It might just be asking for help or asking questions, but it's really important to do that so that you can be successful. Mentorship is so important. As I said, I love mentoring students, but as a new faculty member, whatever role you're in, having that one person who can kind of be your go-to person, and someone that you can ask for that, maybe one-off advice, I think is really helpful. And I know that most faculty have mentors so that they want to be mentors as well. So I think that it's a relationship that's really important for you to feel supportive.